Hi, I'm Scott Sauer, orthopedic surgeon with Roper St. Francis Physician Partners Orthopaedics. A lot of times the patient comes into the room and we're sitting there and I know that they're uncomfortable. They're in pain or they have a chronic problem that some people have trouble describing. So it's my job to make the patient feel comfortable and to solve their problem as best I can. I really feel very comfortable with any problem, particularly orthopedic foot and ankle. I mean, that's right in my wheelhouse, and the way I feel going into a room, it's very rarely that I get surprised by things. It doesn't mean it's not hard, it's not complex, but I feel very comfortable approaching complex problems because I have the experience that I have and the training that I have. I really try my best to make their experience as good as possible. I want them to be comfortable with me, I want them to trust me, and I want to honestly give them my opinion as to what I think their problem is and what our treatment path is going to be. And whether that's non-surgical or surgical, that's okay with me. I just want to try to get them back to their normal function, whatever it was before this problem happened. When you come to see me, I'm going to give you my best, and we're going to work together to get through your treatment journey. And when we get to the end of that journey, I'm hopeful that you are going to have the best possible outcome and you're going to get back to your normal function.